Today on a special Your Life A to Z health show, we'll hear from doctors and experts on a variety of timely health issues. All that and more. Now, here's your host, Lisa Hafner.
Good morning and welcome to Your Life A to Z. It is Monday and kicking off the week with me is Miss Gail Bass. What a great way to start our week together.
Absolutely. I always learn something for one of these shows, so don't change the channel.
So do I. That's why I look forward to it. We are kind of starting off another great health information show for you. We've got lots of information, including special concerns you may have for your eyes if you have diabetes.
Oh yeah, that's something people in my family have struggled with. So
this
is something people should really pay attention to, because that may be an indicator that you have it, and so people have no idea. So yeah, so that's something people should really pay attention to.
See, great information.
Yeah, and we'll also talk about the ways to help take care of pain if you've been hurt in a work or auto-related accident. I think that happens quite a bit, so that'll be something that people want to pay attention to.
Yeah, and I think I got my worst back pain when I was picking up my son out of his crib, and I heard my back just go throughout my back. Sometimes it's not even like a major accident. It could be something as simple as just turning the wrong way.
Somebody told me they hurt their back when they were picking up the vacuum cleaner. And I said, I think I just bought a vacuum cleaner that only weighed like 5 pounds.
Yeah, it can happen.
How heavy is your vacuum?
It can happen. I know, the strangest things. And we're also going to find out what doctors are doing to help couples who are having trouble having children. Plus, we'll also find out why more men are choosing to have Botox treatments.
They want to look good.
Of course they do.
For the ladies.
Absolutely.
And speaking of a lady who looks good, Wendy Marley will share some workout ideas that can help us live longer and probably have a better quality of life.
Yes, I think so. I think exercise is the key.
You know what, at my gym, there are lots of senior citizens in there, and they're doing weights and stuff. They kind of embarrass me when I have to, like, they lift weights that are a little heavier than.
Do you find yourself, I see the lady who's 20 years old, and I look over to see how many pounds she's doing. I'm like, oh, she's doing that. I've got to do that.
Oh, yeah, and they have their little weight belts on and their gloves.
They're awesome.
I'm like, go, Grandma.
They can beat me. A lot of them can beat me. But right now, we're going to get things started with an issue that is a problem for many people. And statistics show that over 33% of adults in this country are actually obese. Many have tried every diet in the book, and nothing seems to work. I hear that a lot. So joining us right now to talk about a surgical way to win the weight loss battle is Dr. John DeBarros from Zap Hunger. It's good to see you, Dr. DeBarros. Thanks for being here today.
Thank you. Thank you for inviting me.
We're going to get to your story, too, because you're a patient and a doctor. But first, let's talk about what is the lap band procedure exactly?
The lap band is and I have a model of it right here, essentially. It's a very small device that's placed around the upper portion of the stomach, and we suture it into place to prevent any movement, and that's sort of connected to tubing, and tubing is connected to this little port. And the port's underneath the skin, and so everything's concealed. Essentially, it restricts the amount of food that you can take in. It makes patients feel fuller, faster, and it also makes patients have a longer time in between meals, so they have a great satiety.
Now, only a certain group of people are eligible for this type of surgery, correct?
Right, correct. Currently, we use what's called the body mass index, and the body mass index is basically your height divided by your weight. And the FDA criteria is for a body mass index of about 35. So anywhere from about 50 to 75 pounds overweight is where we start for patients who are qualified for this surgery.
And we were talking about this earlier, too. There's so many benefits to lap band. You were talking about a woman who was 65 who had the procedure. Just your overall health is greatly improved.
Yeah, it does reduce a number of comorbidities. One of them, the most significant one, is diabetes. The lap band has been shown to have about a 77% cure rate, not amelioration of symptoms, but actual cure of diabetes.
Wow. Meaning they stop taking the insulin and all that?
They stop taking everything. You know, I have, on average, the majority of patients are off all their diabetic medications within 6 months.
What I asked him earlier is, like, what's the downtime? And I couldn't believe the number you told me, because I know it's less invasive than gastric bypass.
Gastric bypass is a big operation with a lot of risk to it. Lap band is a smaller operation, a lot less risk. The average hospital stay is approximately 23 hours.
Wow.
And it also could be done for younger patients more like on an outpatient basis.
Well, we have some video, actually, that kind of gives folks an idea, because you said it's a lot less invasive.
Sure.
And that's what I think the key is. That's why you're only in there for, what, maybe a day, and then you're able to go home.
Typically, our operative time is about 35 minutes. This is a picture of the band going actually around the upper portion of the stomach, and that's where it's connected. And in the office, we put a little Novocaine on your skin and inject a little salt water saline into the tubing, which fills a little balloon up in the top of the band. and that balloon is what gives you the restrictions. So you can eat, and you can eat all of the foods that you were eating before, so you haven't really changed your food quality of food or types of food, although you want to eat healthier, but you're changing the quantities, and so it's a purely restricted procedure.
And Gail, did you know Dr. DeBarros is not only a surgeon, but you're actually a patient of the same procedure.
Right.
That is nice to know. I mean, if you're going in to see him, you've actually been through it.
Absolutely, I've been through it. And so for me, I had about over 100-pound weight loss in about 14 months. And so currently I'm down to about 190 pounds now, which is very good. My BMI is just about 27, so I have about 10 or 15 pounds to go.
So how long will it take for that weight to start dropping off? And they obviously won't see immediate results, or will that weight start coming off that first week or that first month?
Well, it starts coming off pretty much immediately. And
really?
So the lap band is a little bit more gradual weight loss, approximately 8 to 10 pounds per month. So it's nice and gradual, and over the course of the year, you can see it just adds up.
Which is probably very healthy for the patient, too, a nice gradual weight loss.
And the good thing about the band is that because we can inject saline into it, we can adjust the intake of the patient. So if they need to have a little bit more restriction, we can adjust it based on how full they feel and how much weight they're losing.
It's nice as a patient knowing that you've been through it. So when we're asking you questions like, yeah, well, I've been there too, and let me tell you that's normal, or that's not how it's supposed to be because you've been there. Tell us a little bit about Zap Hunger as well.
Zap Hunger is a surgical weight loss program that we have at the Surgical Specialty Hospital in Phoenix here, right on 19th Avenue. We have a website if patients want to go to it, www.zaphunger.com, and it's composed of 3 surgeons, myself, Dr. Orris, and Dr. Simpson, who are part of this surgical specialty hospital. And that's where we do the majority of our surgeries. And you can visit us in each of our offices, or come to the website, or go directly to the hospital to get information.
You know, you said something earlier that you alluded to, and I know I'm going to get a call from my mom who's struggling with weight loss, and you said a woman who was 65 had the surgery. Is there an age limit, or?
Well, typically, you know, I don't have an age limit for patients. It depends on their additional medical problems they have, and, you know, as you know, surgery is a risk and benefit for everyone. So if the risks greatly outweigh the benefit, obviously don't do it. But, and that's why you have to have a physician there who's experienced, who needs to assess this. But if the benefits outweigh the risk, then it's something that we can sit down and talk about. But, you know, for patients who feel like they have no other alternative, and have tried multiple diet and exercise programs, which most of these patients have, with minimal results, this is a procedure that can give you fantastic results.
I'm glad you say that, because when people write in about weight loss, they always say, what was that plan? Because I have no hope. I've tried everything. This gives them an option.
Oh, yeah. Yeah, especially this woman we were talking about who was 65 and has a whole new lease on life, playing with the grandkids.
I saw her yesterday, as a matter of fact, in the office, and she looks phenomenal.
That's great.
You know, from somebody who has tried her whole life, she told me she had tried for 20 years to lose the weight, and now she's went from approximately 297 pounds down to about 145 pounds.
Wow, good for her.
Never too late. If you're sitting out there thinking, oh, there's just nothing for me, maybe this is a great option for you. Thank you for explaining all that. It's good to see you,
Thank you very much for
DeBarros.
inviting me. I appreciate it.
Absolutely. And don't forget, if you would like more information about Zap Hunger and the Surgical Specialty Hospital of Arizona, you can visit their website at zaphunger.com, and there's the toll-free number right there that you can call. Thanks again. All right, when we come back, we're going to talk about what you